we're hearing a lot about the particular vulnerabilities of certain countries and parts of the world to climate change and its impact on health and food. Jean-Yves, you've worked in many fragile and conflict-affected states, and I think that when we see that climate change is having an impact on health, there's an increased reliance on medicines. And the Fondation Brazzaville is looking at how to limit inflows of fake, falsified medicines into communities, particularly in Africa. And maybe you could speak a little bit about that as a sort of, maybe not immediately coming to mind, side effect of the impact of climate change on health.
To link the climate change to health is, of course, obvious. Regarding the problem of the fake medicine, is quite, it will have also an effect. Fake medicine is an issue, a problem for Africa and other parts of the world, which is increasingly every day. Let's look a little bit about Africa. Africa imports 90% of its medicines. So any medication in Africa, 90% has been imported. They don't produce their own medicine, and the availability in Africa is terrible because of the price of the medicines. When you think that an antibiotic will cost about $3 and is 3 times what a family will earn per day, they are very much attracted by people offering similar medicines, we will cost 10 cents or 15 cents. So that leads us to maybe some figures. There is a clear estimation from the WHO that about 1 million people die in Africa only because they have used fake medicines. The last figure I received from 1922 is 125 children has died having taken fake medicine on malaria. 125,000. So we are talking about a huge amount of people who are dying because of that. But also, there is another factor, which is the fake medicines has created a criminal system, a criminal chain, which leads up to the terrorism in Africa. We estimate that today the terrorism in Africa is financed about 60–70% by the trafficking of fake medicines. Why? Because fake medicines, there is no law, or practically no law. If you import a container of fake antibiotic and you are going to kill I don't know how many people, the worst which will happen to you is your container will be seized by the custom and you will have a penalty because you have been importing irregular things. So there is practically no criminal law who punish this system. And so the criminals are encouraged to continue to increase their trafficking. One figure, the turnover of the fake medicines in Africa only is higher than the turnover of all the drugs in Africa and Europe, and with no risk. Of course, it's a very complicated thing. A lot of people have been looking at, and of course, major health organizations, but no one knows how to tackle this horrible system because it has to be, the whole system has to be changed. And is what my foundation is trying to do through a pilot experience in Togo. We call it the Lomé Initiative. And I must say that we are very happy that we are getting the support of most of the people, including the government, and we are going to look how, at the level of a country, we can tackle the tracking of the medicines, the judiciary, the corruption of the customs, how to do with the fake medicine when it says. We cannot burn it because the pollution which will be out of a container of fake medicine is absolutely immense. So we need some special system to destroy them. So it's a long chain of action which we are trying to look at on a specific project, which is the Lomé Initiative.
Jean-Yves, tackling a global threat like climate change requires coordination between states. And one of your foundation's activities involves coordination at the diplomatic level between different governments. Could you speak maybe to how, particularly in Africa, there are efforts, or there could be more efforts, to improve coordination in response to threats posed by climate change, whether food, health, or simply trying to manage other aspects of the crisis?
That's a very difficult question to answer. How to improve a situation which has been there for such a long time and people seem not to be so interested. One of the problems, of course, it's a global problem, I believe. It's a problem of how the South should be looked by the North. What has to be changed? Like North institutions, the IMF, the World Bank, the Security Council, which ignores completely Africa and was been built at a time which is not the time of today. So yes, there is a necessity to have a better dialogues between the South and the North. As President Macky Sall said yesterday, we have to look at the future with the South as partners and accept the fact that the North will not anymore be the leading party and will decide what the South should do. This is a long exercise, but I think with the willingness of the parties, it will be achieved. Anyway, one thing is certain, is that in Africa today there is one word which prevails: sovereignty. Today, the countries of Africa doesn't accept anymore to be under the control, the guidance of the North. And they are looking for another alternative, another issue. And I believe that it's time for the North now to accept the fact that the way we work and the way we function is not anymore the way the world of today, where the world of today should prevail. So this is just a general feeling. Of course, it's very large, and we are trying to help in this concept and perceptions.
Thank you, Jean-Yves. And